Okay, we're going to be starting an IV here today. When you first walk in the room, and this is of course after you have verified your order and informed and educated your patient ahead of time. So we come in the room with all of our supplies. The first thing we want to do is to pad our bed, and then we want to prepare our supplies. We have a saline lock that comes in a sterile package. We can reach in and get it without touching this needleless adapter, so it's still sterile. Take our saline, pull down on it initially because it's going to be very stiff when it first comes out of the package, and that keeps you from squirting it to the ceiling. Purge the air, and then go ahead, attach it, and flush your lock, so you're filling it with saline rather than the air. I like to go ahead and remove the little cap off of here because it's easier for me to access, and then lay it back in the sterile package so that the tip of it remains sterile. I have a IV start kit, has all my supplies in it. If the facility that you're going to does not have an IV start kit, you may have to gather the supplies individually. We normally use, most places now are using the chlorhexidine, and it's more effective than alcohol, and you don't have to do the circular motion with it when you're scrubbing. 30 seconds in a dry area is the length of time you need to scrub, but like if you're in the antecubital site, you need to scrub for 2 minutes. We can go ahead and put our tourniquet on and identify a site, and you know that you normally want to start distally for the first IVs and then work your way up. We'll say that this patient's already been having one in the lower part, and I'm going to choose this nice vein that's shining here for the camera. I may, as an inexperienced person, at that point remove my tourniquet because I don't want to leave my tourniquet on too long. Now, an experienced nurse will just go ahead and get things ready and do the venous stick, but you guys will take a little bit longer. So I'm going to go ahead and do my scrub, squeeze the wings on here, which breaks a little ampule that's in there, and then I'm going to do a nice 30-second scrub back and forth. And once I've scrubbed it, now I can't be touching on it then to palpate because I don't want to contaminate my site. All right. Now when I'm putting my tourniquet on, you want to pull it as tight as you want to get it, put your thumb and forefinger on it, and then just push one finger under. Oh no, here you go. All right. And this is something that you need to practice on each other. Also, I forgot, I should have went ahead and opened this up, done a quick check on it. Make sure that it slides well, that everything is good on it. Okay, so I'm ready to do the stick. I need to stabilize the vein. I can do it by kind of holding it like a C. I want to make sure that I don't have my thumb right up on the vein, because if I do, obviously, then I can't lower my angle. I want to go, the book tells you 15 to, I think, as much as 40-degree angle, but that's very high. You really preferably want a low angle to go in through the skin. I want to hold it bevel up, hold it with my middle finger and my thumb. That leaves my forefinger then to advance the cathalon, because once I'm in, I'm going to advance the cathalon, keep my finger on there, and then I'm going to pull back until it clicks. So all of that stays steady. Okay, so I'm pushing this forward once I get in. All right, so And I like to kind of steady my finger on the patient because it helps me, and you'll all develop your own way. So I'm going to go in, and as soon as I get through the skin, I want to lower my angle. I see a blood return, advance it just a hair further, push my tab forward till I get to the insertion site, pull back until it clicks, remove my tourniquet at that point, and then I want to occlude the vein. I'm going to leave my forefinger and my thumb free to stabilize this little blue part of the vena cava. And on a real person, you can actually occlude the vein much better. I am avoiding the actual insertion site, so I'm not touching there. Alright, and I want to quickly, there we go, attach that, screw it on, clean up my blood mess. Okay. And then if I don't want any tape underneath my tegaderm, but I may have cleansed an area, torn one piece of tape, and at that point I can attach it back here on this tubing that's not going to be underneath my tegaderm, and that keeps it secure so that you don't accidentally pull it out. I then can attempt to do my flush. If it should flush easily, the fluid should push right through. If you begin to push it and it's difficult, and you're always watching actually right about the area where the vena cava ends, and you're looking for like that little bit of fluid to appear to come up to the surface of the skin if it's not in the vein. But if it flushes smoothly, easily, go ahead and flush it with a couple milliliters and then lock it off. You can disconnect. At that point you can apply your tegaderm, and you want your insertion site to be about the center of your tegaderm, and because this is your barrier against germs. Alright, now if there is a portal of entry, the most likely portal of entry for germs is right here at this tubing. So that's why I will often then take an extra piece of tape and cover that area and include my loop here from my saline lock. I like to bring it around and tape this tape to itself before I then attach it to the skin, and that leaves it a little more mobile so that it's easier accessible. I do need to label my site. This gives you easy access. I can write my time, date, and gauge vena cava on here, peel this off, and attach it. I don't want to obscure the site with it, so I'm going to attach it over to the side. Certainly, I want my site visible so that I can observe for redness, signs of edema, such as that. And at this point, if the patient were ordered to have IV fluids, I could simply take the IV tubing and cleanse my port, of course, because at this point I've likely contaminated it by touching it. Cleanse my port and then just screw the end of the IV tubing onto this, and you would be good to go.